Hello, and welcome to the first episode of Behind the Insights, where we pull back the curtain to share real world data, AI, and evidence generation insights from the industry's top thought leaders. I'm Maria Demko, and today I'm excited to be joined by Joseph Zabinski, VP, Head of Commercial Strategy and AI at OM1, where he oversees design, implementation, and the evolution of OM1's commercial strategy. He also oversees as subject matter expert and thought leader for Phenome, OM1's AI digital phenotyping platform. Welcome, Joe, and thank you for being here today.
Thanks for having me, Maria. Delighted to be here.
So many people are familiar with the promise of AI through applications like Chat GPT and other virtual assistants like Google Gemini. But today we're going to be focusing our discussion on how AI can enhance real-world data, or RWD, specifically in dermatology data. So to start, can you talk a little bit about some of the challenges of working with real-world dermatology data and how AI is helping to address them?
Yes, definitely. It's true of all real world data, and I'd say especially true in dermatology data, that we can often get very rich, very detailed insights into the patient history. And at the same time, we can still have these frustrating gaps where, there's a question that we might want to answer, but the data just don't support that because they're incomplete or because, a clinician just simply didn't ask the question that we really wish they had asked during a clinical visit or something like that. And so, it's this paradox that I think anyone familiar with working with real world data in these areas will have experienced themselves. With respect to AI and how it can help, there's a number of different levels and layers that we could talk about, and we'll probably get into some more detail on them. But just to sort of give the high level impression, first, you can use AI to augment data sets. So we can simply take the data we have and we can use AI modeling to learn from things within those data to make the overall data set better. One good example here is, we have the advantage of being able to work with a lot of unstructured data in dermatology, so clinician notes specifically. But using those notes, we're able to do things like use AI to estimate a patient's disease activity at a point in time. So based on the doctor's narrative description, we can say, oh, the patient was in a worse state or better state of disease. And that can help fill in some of those gaps in the data set. One level deeper, we can do things like, say, for example, learn from a patient's trajectory in their disease, and then let that learning tell us something about that patient's future risk or, the likely presence of an undiagnosed disease, something like that. So, for an example, in a disease that has a progressive trajectory, we might say, here's a patient who, got diagnosed and progressed over a number of years. Let's look at that progression and see if there's somebody else out there who is sort of on a similar path much earlier in that journey. AI is very good at that sort of learning and then applying aspect. And again, it's just another way to sort of help us get more value out of these real world data sets in dermatology. So, there's a couple examples there, but many more where the overarching principle is making more out of the data that we have.
Can you elaborate on the role that AI plays in the integration of RWD for dermatology and how this can ultimately impact patient outcomes?
Yeah, so I think classically, if we think about real world data, those data are obviously generated in the real world in routine clinical care, for example. And we would gather those data, we would analyze them. We might reach some conclusions, right? We might do some statistical tests or whatever, and then publish the results of those analyses. But to actually implement the consequences of those analyses for those results to get back into clinical care, someone would read the study, they'd sort of remember its conclusions. Maybe that would mean, something about um, being a little bit more proactive on screening for a new disease or something like that. AI can really help shorten that cycle between the insights in the data and the impact of those insights in clinical care. One way that happens is, for example, if we have an AI module that learns something like, what happens before a patient gets diagnosed with a particular disease, and then once we've captured that set of happenings, once we sort of know what that set of patterns in a patient's history looks like, we can just put that AI agent, that AI module into an electronic health record system, for example. So now, we don't have to go through that translational process. We just say there's an AI embedded into the electronic health record system at the point of care that's learned from a bunch of patients who are trying to improve something about. and can now dynamically call out, patients who might look similar to those that we studied previously. So the dermatologist can just say, okay, here's somebody that the system, for example, is calling out as at risk of an undiagnosed disease. Should I pay more attention to them today? So I think shortening that connection or the distance, let's say, between the insights and the data and the impact on clinical care is one of those ways AI can help.
OM1 collaborates with the American Academy of Dermatology DataDerm network. Can you share a little bit about how this partnership is working to improve patient care and dermatology research?
Yes, so it's a really great collaboration that we have with the AAD. We've been partnered with them for a number of years now, and both from a research perspective and a data perspective, I think it's been quite a fruitful partnership. At the core, the DataDerm network, the DataDerm registry, is a really significant, really deep and rich set of data about patients with dermatologic disease that is drawn from clinical practice of dermatologists. So it gives us very rich insight into what's going on with those patients in the real world. And, sort of concurrently, the AAD being very closely connected to that community of practicing dermatologists offers a lot of opportunity for sort of back and forth communication and thought development about the learning that we take from the data as it feeds into clinical practice, right? So, what questions are of greatest importance to the dermatologic community? What issues are actually seen in clinical practice? And then in the reverse direction, when we're studying tens of thousands, hundreds of thousands, millions of patients with different skin diseases, how can we take what we learn from those populations and make them relevant for that community of practitioners? That's something that we can do by staying in close contact with our partners at the AAD. So, I think from the sort of raw ability to work with such a good data set, and then to the broader ability as well to connect to the clinical community very closely, those are, both areas where this relationship, I think, works quite well.
One of the examples of our work with the AAD is with hidradenitis suppurativa, or HS, a chronic skin condition that can be difficult to diagnose and manage, with some patients enduring symptoms up to 12 years before getting an accurate diagnosis. So, where does AI come into play to help improve the diagnosis and treatment of HS for these patients?
Yeah, so HS, as you mentioned, it's one of these funny conditions that's both not rare, it doesn't officially meet the definition of rare disease, but it is significantly underdiagnosed, and the patients who have the disease can spend an awful lot of time experiencing its symptoms, suffering from it, but without getting an accurate diagnosis, which means they're very likely not getting the treatments to help them with their symptoms, to say nothing of hopefully arresting the progression of their disease. What we're trying to do there, and it's not dissimilar to other applications of our AI technology, is to say we know in these large scale real world data sets that we have a bunch of history on patients who ultimately get diagnosed with, in this case, HS. Let's look at what those patients share in common in the lead up to that diagnosis. So in the preceding year, 2 years, 3 years, whatever it is, let's see what symptoms they had, what medications maybe they tried and failed, what doctors they saw, what comorbid conditions they had, all these little bits and pieces of evidence that those patients who end up diagnosed with HS share, and that distinguishes those patients from everybody else, including those with other skin diseases. And once we have all those different bits and pieces of information gathered up, our AI system, our Phenome platform, kind of compresses all that information into a digital phenotype. I think of this as a fingerprint in the data. So now we know there's this sort of fingerprint for HS that exists in these data sets. And once we have that fingerprint established, which is the work that's ongoing now, we can then say, okay, are there other patients out there whose records look close to the fingerprint, but who aren't diagnosed with HS? If so, if there's a pretty good match, we can say this is someone who's at elevated risk of undiagnosed disease. And maybe for that patient, we can then shorten that diagnostic odyssey and kind of accelerate their time to accurate diagnosis and ultimately to treatment. So that's how we're using AI to attack this problem of underdiagnosis in HS.
So, while we're on the topic of HS, can you talk a little bit about the collaboration between the AAD, Novartis, and OM1 on this condition?
Yes. So the work that we have ongoing right now, it was started in the latter half of 2024. It's funded by Novartis and it's conducted by the AAD and by OM1 in collaboration. And really, the initiative has a number of different pieces. The one that I was just describing, where we're calibrating a phenotypic model or phenotypic fingerprint for HS, is sort of the core technical piece of this collaboration. But beyond that, um, we also have a sort of work stream that's devoted to translating the effects and what we learn from that phenotypic isolation to the clinical community. And so one of the ways that that happens is the AAD has assembled for us an expert advisory panel of practicing dermatologists who are expert in HS so that we have their feedback, their contributions, their thoughts as we develop these digital phenotypes so that we know that, what we're putting together will resonate with and be relevant for the clinical community. And ultimately, the conclusions we draw, the lessons we learn, get translated into education and awareness for the clinical community so that, we have the technology and we have, sort of those other aspects that help us to make the technology relevant for providers.
So, you've worked closely on the development of OM1 Orion, which is part of the larger phenome umbrella, and this helps researchers map patient journeys for conditions like HS. So, can you explain how Orion works and why it's valuable for pharma researchers?
Sure, yes. So Orion is really, as you mentioned, it's one of our solution lines under our broader phenome digital phenotyping umbrella. And it really is about understanding patient journeys. It's about filling in gaps in those journeys, but also about understanding in some of the ways I've given examples of sort of when we can learn from a journey from a group of patients. What does that mean for other patients and their records? What can we say from a research perspective or a clinical implementation perspective about, patients' journeys as they evolve? One of the biggest uses I think that we find, probably the thing I'm asked most often about, is this question of underdiagnosis or misdiagnosis. And sometimes that's because we want to go out in the real world and find patients who more likely have an undiagnosed condition. Other times, this is because, we want to study those patients at the data level. We know that the disease we're studying is much more prevalent than diagnosis rates in a data set would suggest, but we don't know how to put our finger on those patients that we're missing. They might be in the data set more broadly, but we don't know who they are without something like phenotyping. With this system, we can then say, here's a group of most likely undiagnosed patients that we can study. We can say, are they similar to, different from those we know about, and so on. Um, there's other aspects as well with respect to the journey. For example, we can do things like say, when patients start a medication, who's more or less likely to respond well to it? When patients are newly diagnosed, who is more or less likely to experience a certain adverse outcome? All of these are journey insights, and they let us sort of be more precise about how we study patient cohorts within that journey.
We also know that skin diseases like HS often come with comorbidities such as depression and obesity. Can AI-driven solutions help identify and effectively manage these comorbid diseases as well?
Yes. So it's an excellent question. And a lot of times I think we do tend to think, as you said, about comorbidities as sort of like Lego blocks. They sort of build up as these discrete pieces. And of course, in reality, in patients' lived experience, their depression is intimately interacting with their psoriasis and their obesity, right? These aren't three distinct things. They're all part of the patient's experience, and sort of what they deal with on a daily basis. AI can certainly help us, and digital phenotyping in particular, can help us identify if there are, comorbidities that haven't been identified in those patients yet. But I think the more powerful application in these sorts of situations is to say, you know, we can think of sort of like a psoriasis patient with depression as just that, somebody with psoriasis who also has depression. Or maybe if you look at it from the mental health perspective, it's a patient with depression who also has psoriasis, right? This sort of additive way of thinking about it. The digital phenotyping might say, maybe we should think about this nexus, this combination of characteristics as a more distinct kind of patient. And maybe that more distinct kind of patient is better helped by a certain combination of treatments or is at greater risk of a certain kind of outcome profile or things like that. In other words, the AI can help us say, sort of unburdened by the way that we would classically sort of add up these comorbid diagnoses. We can just say among this patient population, let's say with psoriasis, for example, split it up into a bunch of different subtypes who have different characteristics, right? Heterogeneous disease, but split up into a bunch of more homogeneous pockets. And then we can start studying those homogeneous pockets to say, what does this group have in common? What does that mean with respect to their journey, with respect to what they need, with respect to what treatments may make sense for them? And I think that that ultimately gives us a much richer and sort of more nuanced view of patients' actual lived experience than the simple sort of binary way that we typically think about it of, you have disease A, do you have disease B? Yes or no. Do you have disease C? Yes or no. That's a sort of reductive way of thinking about comorbidities.
So, looking ahead, what future advancements do you foresee in AI for dermatology, particularly in personalized treatment?
Yes. So, of course, there's a whole world of work that's being done, not really by us, but, very excitingly by others in using AI specifically to read, analyze, look at skin images, which is obviously of great relevance for dermatology. I think there's good work that's been done. There's a lot of good work left to be done in those applications. But they do plug into this broader question of how AI will evolve for personalization in dermatology. And I think that there's really exciting potential, and it's not that far off from being realized. I think, there's a few big themes that stick out in my mind. One of those is this notion of getting specific or personalized for patients with common, complicated diseases in dermatology, where we say, yeah, we know that, we have half a dozen effective drugs for this common condition. Some work for some people, some work, for others. Um, we don't really know at the individual level which treatment will be best, right? Using AI to say, well, this patient looks like a bunch of others who benefited from treatment A and not treatment B or treatment C. So maybe that's worth considering more closely for that individual. That's a kind of personalization that I think is actually quite close to being real. It's powered by these insights that we get from large scale data sets as well as, intelligent AI kind of figuring out the connections. But it moves the needle quite dramatically because it gives us a much more personal ability to talk about treatment. And then the other big one that I see is just on this question of diagnostic odyssey, diagnostic journey. In addition to the very common heterogeneous skin diseases, there are also many, many diseases, as we've talked about a few, that go undiagnosed or misdiagnosed over time. And I think that, again, when you talk about personalizing around rare disease, the answer for the vast majority of people is that your risk is very low, right? Um, but if we can say for this one person out of 1,000 or out of 10,000, their risk is actually much higher. That again is an instance of personalization that can hopefully shortcut a bunch of steps that would otherwise happen and get right to the question of, okay, can we think about a confirmatory diagnosis here? Does this patient actually have this condition? I think if we can tackle those two things, improving diagnosis and improving treatment and management at a personalized level, we'll have done a lot of good. And I think both of those are very feasible in the short term for AI in dermatology.
Great. Thank you so much. Thank you for being here today and sharing your expertise with us. For our audience watching and listening, you can find out more information about Phenome and OM1's dermatology data network on our website, om1.com, or you can follow us on LinkedIn and X. If you'd like to get notified about our next episode, be sure to subscribe to our email list to keep updated on the latest insights. Thanks again for joining us, Joe, and thank you to everyone watching. We'll see you again next time.